I'm Ed Gillespie, Republican nominee for Governor of the Commonwealth of Virginia, and I'm glad to spend time with healthcare leaders from all across Virginia today to talk about what is a critically important issue in this election, and that's making sure that we provide affordable, accessible healthcare to more Virginians, and I'm eager to talk about my plans to do that with you here today. Now, when I started this campaign, I was locked in on the opioid and heroin epidemic that we're dealing with all across Virginia. And I would talk for months about how, on average, 3 Virginians every day die from opioid and heroin overdose. And a couple months ago, I had to change that to 4 Virginians every day die from opioid and heroin overdose. And we have got to address this crisis in our Commonwealth. And that's why I've put forward a plan on mental health, addiction, and recovery. And we need to make sure that when someone is in addiction and they hit a crisis point, that they reach out to get help and to get into recovery, that the Commonwealth of Virginia is there to take that hand and to get them into recovery, whether it's inpatient or outpatient or medically assisted. But we also need to make sure that fewer people find themselves in crisis. And so we've got to get intervene earlier in the process to get people into treatment and to get people help. And my plan on addiction and recovery is informed by a couple of key principles. The first, though, is maybe the most important. Addiction is a disease, not a moral failing. And we're talking about sick people who need to get healthy, not bad people who need to get good. And that needs to inform our policy, and it informs my plan. The second thing related to that is we are not going to arrest our way out of this epidemic. A third principle is we've also got to put a greater focus on prevention, and we need to get to children before the drugs do. And today that means getting to them in around 3rd grade to make sure they understand the dangers of opioid addiction. And it's not just teachers and schools, which it is, it's also sports leagues and coaches and the faith community, and we need to bring a lot of resources to bear in this regard. And part of my approach to addiction and recovery is also what's known as the collective impact model, to make sure that we are collaborating with faith-based institutions and peer-to-peer recovery specialists, and bringing to bear not just the government, which we need to, but also the private sector, the creative community, and the faith-based community. But my quick answer is, maybe not that quick, the biggest challenge we face right now from a healthcare perspective, to my mind, in terms of a crisis, is the opioid crisis. Well, one of the parts of my plan, one of my 20 plans, Health in Our Commonwealth, which I put forward a while ago, addresses the need for greater transparency in pricing in our healthcare system. And there are a lot of ways that we can do that to empower the consumer and have an informed consumer in the healthcare marketplace. One of them has to do with when you incur out-of-pocket expenses from out-of-network care. And that is a surprise often to consumers when they get hit with that higher cost. And so one of the things I want to do is have balanced billing, and to make sure that before any expenses incurred out of network for a consumer, that they are apprised of it and aware of it beforehand, rather than getting hit with that expense and what is an unpleasant surprise later. So greater transparency and balanced billing, I think, would help ease the burden on consumers in the healthcare marketplace in Virginia. Well, I guess in some ways I kind of answered this, because it is, to me, the number one crisis that we have to address from a public health perspective in the Commonwealth of Virginia. And I do think that making sure that when someone reaches out for help, they're active in their addiction, that they're able to get help, and that would be a priority for my administration. You know, if you don't take that hand at that moment, that person may slip away, literally never to be seen again. And so ensuring that we have the ability to provide and to get people into inpatient or outpatient or medically assisted care when they realize that they're at a point in crisis and they realize they are in addiction and they need help in battling that disease, we need to make sure that we're able to help them. I also, like I say, preventing people from getting into that situation, intervening earlier before crisis, but also preventing young people from finding themselves addicted to opioids is a critically important priority for me, and doing that not just through the schools and teachers, but through coaches and sports leagues and the faith-based community is also a critically important part of that as well. And I want to make sure that when someone, for example, who is on probation or on parole, if they relapse, that they are able to step forward and seek help for their addiction without fear of being reincarcerated for violating the terms of their probation or their parole. So I've put forward a number of specific plans for my addiction recovery and mental health policy proposal, and all of these are available on my website, edforvirginia.com. But you can also go to a whole separate website I have where all my policies can be found, and that's forallvirginians.com. And my healthcare policies and approaches on health in our Commonwealth and addiction recovery and mental health, as well as 18 other specific detailed policies you'll find there. And I hope you take a moment to look through those, and I think you'll like what you see.